Our conversation today is super important for you. We're chatting with Darrell Rogers from the Council of Holistic Health Educators. The Council of Holistic Health Educators protects and promotes holistic health professionals like us. They defeat legislation that restricts our community, and they lobby to pass laws protecting and growing our diverse professions' ability to practice. They educate policymakers, build grassroots support, and train holistic health practitioners to become involved in the policy process and win. This is an important conversation. Bookmark this one to listen to a few times and bookmark holisticcouncil.org too, so you can critically stay on top of the legislation threatening and supporting health coaches. Hi, I'm Erin Power.
And I'm Laura Rupsis.
We're certified health coaches, and this is Health Coach Radio.
This podcast is about the art, science, and business of health coaching.
We share our insider tips to help you become a better coach and entrepreneur.
And we interview expert guests to discover how they've made it in this growing field.
It's time for health coaches to make an impact.
It's time for Health Coach Radio.
All right, Darrell Rogers, thank you so much for joining us today. We're excited to have this conversation. Lots to talk about.
There is. Thank you so much for having me.
So I don't want to spoil your own little intro. So Erin and I like you to just sort of introduce yourself and sort of who you are and why you're here. But I will just little spoiler alert. So you are now essentially running the Holistic Council or the Council for Holistic Health Educators. So I'll let you explain what it is you guys do. But Primal Health Coach has been a supporter of your organization for years. I'm actually on the board, which is, disclosure. And so there's so much that's changed. But if you wouldn't mind, give everybody your background, kind of how you sort of entered this health coaching realm and how you ended up taking over running of the council.
Will do. Thank you so much for having me, Erin and Laura. And a big thanks to Primal Health Coach for being a big supporter of the Council of Holistic Health Educators and all of our supporters. You can go to holisticcouncil.org, and we recommend everybody do that to check out our outstanding website, the content that we have, and our supporting schools and programs. I have been involved in politics and policy for over 20 years. I came to DC in August of 2001 and caught what they call Potomac fever and stayed. I've worked on Capitol Hill. I've worked for large nonprofit organizations, small nonprofit organizations, those much despised K Street lobbying firms, but then found my way to a really interesting organization. We handled a lot of natural products issues with the FTC and FDA, and I wound up working with a number of different integrative physicians at this trade group. And it was there I started researching, writing about, and really getting interested in the policy of nutrition practice, and just kind of fascinated that it's different in every state. It was changing. This is around the time of the Affordable Care Act. So there was a lot of conversation about, wellness programs and preventative care. So I just found it just a fascinating place. And I was writing about the policies and changes, and got in touch with Joshua Rosenthal, who had started, was the founder and CEO of Integrative Nutrition. And we just kind of developed a rapport. And then he asked if I wanted to join him at Integrative Nutrition and be their director of advocacy and policy. And I was there for 9 years, directing the company's practitioner education, practitioner understandings of policies and regulations, but also doing a whole lot of work in Washington, D.C. for IIN, but also the broader health coach community, raising the profile and recognition of our health coaches. So I was there until the end of 2022. And that's when Jonathan Posey, the former director of the Holistic Council, or the Council of Holistic Health Educators, moved on, and just thought it was a pretty good fit that I pick up the reins and run with the organization, because it does some really valuable work for our community.
Mm-hmm. Wow. Okay. Sounds like a pretty perfect fit. It's interesting. I'm so excited that you come from this policy and politics background, because And I don't know if anybody else listening is excited about that too, but I think that's who we need. That's the kind of person we need. The pragmatic sort of approach to understanding and advocating for us in DC. One thing that really struck me as being frustrating, actually, and unusual, when the way you said it was the policy of nutrition practice is different in every state, which, yeah, we know that. We totally know that. We're going to talk about that a lot today. But when I zoom out, it's so interesting because the principles of nutrition are so generally known, but the way it's distributed is political. You know, the way that consumers can access it is throttled or facilitated by policy. And I always feel for the health consumer, how confusing it is for them. Do you have any thoughts on that? How the health consumer ends up being sort of swept under the rug in all this infighting?
It's a really great point, because we often see it as quite simple, right? If we kind of choose to eat these things, we kind of keep a food journal, we understand micronutrients, and we can kind of navigate through coaching, nutrition, maybe online tools, like a pretty healthy way of going about the world. But then you realize that this food environment is a $1 trillion industry. It is trying to be manipulated, sold, packaged, cost reductions the entire way through. And that, large food and agribusiness and pharmaceutical industry have a whole lot at stake. And so, when there's that much influence and that much money behind something that, we view both probably as a right, to be healthy and have access to healthy foods, but also something that doesn't seem to be that confusing for us. Yes, it's incredibly overwhelming and confusing for the vast majority of people. I mean, just think about the varying and nutrition advice that we've just gotten over the past, few years about what an individual should be doing. And then you put on top of that the amount of influence between professional associations and medical associations, and on top of the agribusiness, the food companies, and then the pharmaceutical companies, it becomes quite a challenging world to navigate as a consumer, a practitioner, and then also as an advocate too, for our world. So thank you for identifying that we need at least one person like me doing it, because it is daunting.
Well, and I think we need too, the more the end consumer is educated, the more they begin to stand up for themselves and start to demand better. Case in point, I'm just going to plug the founder of the Primal Health Coach Institute is also the founder of the Primal Kitchen. Mm-hmm. And he launched a product into the marketplace because there was a gap, which was healthy condiments, right? If you go to the supermarket and you take a look at all the different condiments that people put on their food, the vast majority of them are made with trashy ingredients, way too much sugar and really crappy fats. And so his first product was a mayonnaise that was made with a health fan. Long story short, mm-hmm. That product and what he put to market became in such demand that eventually, quote unquote, big food bought him, right? Kraft Heinz bought him. And there was this huge, to a certain degree, a bit of a backlash to Mark that he sold out to the man and to big, but he was like, no, you don't understand. The fact of the matter, this is a good thing for the end consumer, that big food is paying attention and they are acquiring brands that actually are meeting the demand of the end consumer. Big food is listening. And quite frankly, it created a wider distribution. In the past, the only people that could buy, that mayonnaise had to shell out whatever it was, $12. And you either needed to buy direct and pay shipping or go to Whole Foods. Mm-hmm. No, it's in Walmart. Mm-hmm. Okay. So prices are lower, all of this stuff. So the consumer matters and the consumer has power. And the same thing holds true in terms of where they choose to provide, to get support and advice in terms of their own health, whether they want to seek a health coach or a dietitian. So I would love, or a nutritionist, or whatever's in the mind of the consumer that they think they need. I would love for you to speak to why we even need an advocate for our own ability to practice. Like, we touched on it a little bit, but could you speak a little bit as to kind of what the vulnerabilities are and why we need advocacy?
The American Dietetic Association has been around probably since the 1930s or 40s. They're dietitians and historically have worked in places like hospitals and prisons and institutional settings. And at some point, they decided in the kind of 70s and 80s to be more of a healthcare provider and not just a food provider. And they drafted bills that were introduced in a variety of different states, stating that the practice of dietetics is something that if a lay person gets involved in, it could be dangerous for the public, and therefore there needs to be government regulation. And interestingly enough, I went through I did a good amount of research in this and found the first article about it from 1978. It was in the Washington Post, and the Washington Post had, questions about, essentially why are you doing this? And it's funny, here we are in 2023 asking the same questions. So there was a real effort in the 70s and 80s to pass this type of regulation. It benefited, their profession and their membership. Many organizations and associations engage in this kind of behavior because it benefits their paid membership, but also they created an entire kind of ecosystem. So you go to their schools, you see their professors, you take their degrees, you take their examinations, you do your 1,000 hours of unpaid internship. And so they have a whole ecosystem that they need to support. And one of the best ways of supporting that ecosystem is mandating that only a few can do it and many cannot, and it's going to be costly and you have to go through their processes. These laws were passed in about 25 or 26 in varying ways to determine whether they're there or not. About 25 or 26 different states. So essentially the practice of nutrition and dietetics was a regulated act, and you needed a license from the government, your state government, to provide nutrition and dietetics. One of the challenges is that the definitions of providing nutrition and dietetics is really broad and really vague. And, people and regulators and even the American Dietetic Association couldn't really determine, who was and who was not. But what we did know is that, some people were receiving nasty letters and cease and desists, from investigators and state entities. So it was around, and so that was kind of the historical portions of it in the 80s. And then what's wild is that now we're in 2023. We have access to the internet. We have access to providers of nutrition and dietetic advice, interstate, even internationally. I've even been exploring and taking a look at some of the AI tools that are available now for nutrition. There's direct-to-consumer testing. And so one would say, wow, the consumer, as you had noted earlier, Laura, has an amazing amount of choice in the marketplace. There are no longer these barriers. You can see practitioners of all types, interstate and even internationally. The tools that were once only available to maybe physicians and laboratories are now available to everybody. I'm saying, and I think others are too, are these dinosaurs, which are these kind of regulations, are even applicable now to a modern world. So my role is to convince legislators and state agencies that the walls have come down, that this information, this advice, and these tools have been democratized, and any attempt at passing new regulations just flies in the face of reason and just the marketplace. Most understand what I'm saying, what we're saying. Unfortunately, the opposition is, well funded. They have lots of members, and when you have lots of members, when you have a significant amount of money you can dedicate to advocacy, to political contributions, to events, you have some political say. So, we are small, but we are mighty, and really just working to get legislators to realize that the marketplace now has changed so much that practitioners and people have access to tools that they previously didn't. I make the kind of the joke that, these regulations are for horses and buggies, and we're kind of all riding around in, AI powered electric vehicles. And so to try and apply something that was written in the 1960s to something that people live and do every day now is just not applicable. And we don't want, one of the real goals here is that we don't know what health and wellness is going to look like in the next few years, the next 10 years. We don't know what tools and services and practitioners are going to be available to our community. So we want to make sure that there are very few unnecessary barriers and regulations to that really outstanding advancement of science, of health, of wellness, and community.
Yeah, that's wild to consider. Even living in the modern world, obviously the whole thing has changed since these policies are put into place. Obviously, I mean, gosh, how many thousands of nutrition advice, sound bites I'm bombarded with when I open my Instagram account from who knows who, right?
Mm-hmm.
That aside, but so is anybody picking this up? Like, are the legislators realizing, is there any movement toward modernizing these, or is it slow? Is there resistance?
There's been a real, and I'm not just rah-rahing, but there is a real bipartisan understanding around, we want to reduce the barriers to both consumers to get products and things that they find healthy, but also we want to reduce the barriers to employment. It's a conservative and very liberal policy right now that we want to remove unnecessary barriers to people getting jobs and finding employment and being entrepreneurs. And so it really helps our side when I get to talk to legislators and say, like, listen, these regulations really just benefit a handful of people in your state. And there are tens of thousands, if not more, that would be detrimentally affected by this because they might not qualify for that one particular certification. And oh, by the way, that one specific certification is provided by one particular trade group. And they realize that, it is often, legislators are realizing that we want to reduce the barriers to employment. And also we live in a information and services age where just those old policies and those old associations and those old do it our way entities are just not really applicable to our lives. That's not to say that as health coaches, as nutritionists, as holistic health practitioners, that this is a free-for-all. You are still, you still have to be truthful in your services. You still, cannot defraud or engage in any illicit activity. You cannot practice medicine. You cannot practice acupuncture. You cannot practice chiropractic care. These are all very serious things. And our community knows that. It self-polices itself really well. And so what we generally argue is that the danger is so low, but the benefits are so high. And we want to see regulations reflect that.
Yeah, that was going to be my questions. Like when the lobbyists for the ADA, let's say, they're the AND now, right? The Academy.
They're the AND now. I still refer to them as the Dietetic Association.
So they came forward and they made this argument about how allowing lay people to actually provide nutrition advice for a fee of some kind is somehow dangerous. I'm curious where that notion comes from. Have they ever been asked to provide actual evidence of somebody who actually did a consumer harm by talking about food or nutrition?
Thank you for asking that. I actually have an answer to this. When I'm in meetings with them, they will tell legislators and their staff that bodies will be stacked high in the street due to unregulated and unchecked nutrition advice. They will say that just the harms and the sorrow and the destruction will be significant. And then we kind of try not to roll your eyes.
I failed already, but
it's challenging. But when there was the lawsuit brought against the state in Florida, when they sent the cease and desist letter to the health coach, We actually had, by we, I mean, the health coaches, attorneys, and the Institute for Justice actually had the head of the dietetics board on the stand under oath. And he asked her, can you point to, and she's been in this position for like 20 or 30 years, any specific cases where an individual was harmed by unlicensed nutrition advice? And she couldn't. So I've always found it really entertaining that when there is no penalty of perjury, the bodies are stacked high in the street. But when you're on the stand and you can go to jail for lying, they can't find a single case. So that is the answer.
Oh my gosh. So here's the thing. So they're saying there's going to be bodies lying in the street.
Yes.
Literally over the last 50 years, by trying to curtail nutrition advice, the number of people that are obese has skyrocketed. Since the 1980s, we went from maybe 12%. I mean, it was less than 10% of the population to now almost half. Literally almost half. And then you tie in other metabolic conditions that are tied to diet, like insulin resistance, type 2 diabetes, heart disease. They have all skyrocketed. So this effort to sort of curtail access to nutrition advice to licensed, knowledgeable, educated people clearly is not doing the job.
It doesn't seem to be. And that's one of the things that we point out is that the states that have had the strictest nutrition licensing regimes are often the ones that have the worst lifestyle related condition data. And so, so that's a correlation that we point out, that they just don't really have any data on their side that show what they're asking for makes anyone healthier. And one of the points that we bring up pretty regularly, a bill was just introduced last week in the state of Michigan to license, dietitians and nutritionists. And I pointed out to one of their legislators that there's only 4,000 registered dietitians in a state of 20 million. In that same state, there's 140,000 registered nurses. And the state says they don't have enough nurses. So my question to them is if only 4,000 people are going to treat, the state for nutrition related issues, do you have enough people? Are you willing to just say only 4,000 people can treat these, many, many millions? And that's when legislators realize oh, maybe this is not really a great idea. This might actually be making, more harm. Another thing we point out too is that, paperwork benefits the powerful. And it's the people, it's the organizations and associations that have the resources. And, no legislator wants to hear that they're just giving a handout to the most powerful interest groups, but that's what they're doing. And, sometimes you have to call kind of a spade, and it's helpful.
Yeah.
Mm-hmm. It's a good, for me anyway, and I'm not sure if anybody else listening is having the same sort of paradigm shift, because for holistic health professionals and health coaches, the narrative around the legislation and what we can and can't do has often felt like, oh, I'm being sort of restricted to do what I want to do. But the bigger picture is consumers don't have access to what they need access to. It's a complete lack of access. The impact of that.
Mm-hmm. It's a great way to view it. And that's the way we often present it, is that, sure, we always have the practitioner in mind, but we have the end user in mind mostly. That why would we want to limit their choices to just one type of nutrition professional? And registered dietitians have their benefits in their lane, and that's great. And if an individual or an individual's care team or their physician or their healthcare provider says you should see a registered dietitian for these types of services, well, then great. But where we particularly, when we get quite prickly our side, is when that association tries to mandate that pretty much anything nutrition related is only theirs. And you have to have not only their credential, but go through their programs and get their license to even talk about it. And that raises both constitutional concerns, it raises just common sense concerns, and then so those are the policy issues that we are working for on behalf of health coaches, holistic nutritionists, and other wellness practitioners.
And it's just specifically nutrition advice that's regulated. I was just thinking because as time goes on, more clients are coming to me with, it's like, yeah, I need help with food and weight loss, but it's like, but also my sleep is crap and my stress management is crap and I'm not moving enough. Like, do the lifestyle pieces fall under, or is it just food and nutrition?
In the more recent versions of their legislation, there are wellness and health coaching pieces. They will say that, oh, no, we just put those in there, but other people can do it too, but they're just kind of going to be in our scope of practice. But as long as you're not providing wellness or health coaching advice to people with a medical condition, then it's okay. But then we ask them, like, well, is obesity a medical condition? What about high cholesterol? What about prediabetes? What happens if you have a sports injury? What happens if you have a food allergy? What happens if you're pregnant? And you don't get answers. And so that's why we want to make sure that these pieces of legislation don't pass and that we don't allow one trade group who has a real monetary interest in building a big fence and making it all theirs doesn't win.
Hey, it's Erin, co-host of Health Coach Radio. I've trained men and women of all different body types and skill levels, and take it from me, women are made for strength. They may just have a different way of getting there than men do. With the Primal Health Coach Institute's Strength Training for Women Specialist certification, you'll be able to address the needs, challenges, questions, and goals most relevant to women. You'll learn how to design a training program, and then you'll develop one. You'll also learn how to co-create individual eating strategies for clients and how to navigate potentially sensitive topics like menopause, reproductive cycles, hormone-related dysfunction, and diet culture. If you want to empower women to become fitter and stronger, then visit primalhealthcoach.com and learn more about our specialization in strength training for women. Should I just pull back on that for a second? So I just want to make sure I got this clear. So anything that's in the realm of treating a disease is for sure in the realm of the licensed health practitioner, but the subclinical people who just don't feel well, what about that? Which is most people would say.
Well, the words really matter. And this is, I think, important to practitioners. So non-licensed wellness practitioners never use the word treat.
Right.
And we don't.
Correct.
But we work with people with lots of different conditions. Like I just listed a bunch of them. One of the challenging parts with these nutrition practice rules or regulations is that it's unclear whether an individual can work with someone to lower their weight if they're obese.
Yeah.
Because they can say, oh, you can definitely. I've actually had the lobbyists for the Dietetic Association say to me, no, listen, you don't get it. I'm like, okay, well, tell me what I don't get. We're not saying that a health coach can't work with someone who is obese. We're just saying that you can't treat their obesity. I said, well, explain to me the difference, because I've got to go tell hundreds of thousands of health coaches. And they just go, meh, And I said, well, this is not going to pass. Like, I'm sorry, like you can't.
Okay. So I was going to take a stab at this too when you're done.
Yeah. So, it's these types of confusing, vague, and like I said, paperwork protects the powerful. Also, when there's ambiguity, there's often fraud. Mm. And so when people can't actually explain to us our side, what it is they want to regulate, then we're not going along with it. If dietitians said, we work in these specific settings and we do these specific things, okay, sure, then show it to us. We'll but they say, well, anything, anywhere, at any time might be ours. Like, who would agree to that? If I was, the Holistic Council is our community's lobbyist. We have attorneys. Like, if we or our attorneys ever said, oh, no, let's take that offer, you should fire us. You should never give us another dime. I'm sorry, I get a little heated about these things. So,
well, we do too, which is why we wanted to have you on. And there were two things that kind of came up in the last couple of minutes that I kind of want to tag onto in terms of the notion of, do we have enough dietitian, like you were just talking about that one state, do we have enough dietitians to actually help support the likely millions of people that are going to require their support if we were to kind of put this in place? And we have like a real life example of this. There's a company that Primal Health Coach has partnered with. They're called Simplex Health, and they have an entire program, a clinical program where they're working with mostly functional medicine doctors, but they're all MDs. They do use dietitians, and the dietitians are the ones that are actually formulating a specific diet to treat a specific condition. However, insurance will only pay for a certain number of dietetic visits. So once that's over, the client or the patient is left without support, or perhaps they only pay for one visit a month. You've got someone who's trying to make an entire nutritional and lifestyle change, and they get support once a month. Are you kidding me? This is where they're now utilizing health coaches. So we're starting with this internship program. Dietitians have to go through an internship too. Health coaches are going to come in and they're going to go through an internship and understanding how to actually function as a health coach to provide that additional education, support, the resources the clients need to make this change. And they're working with the dietitian alongside the dietitian. And this is the way this should go. So from the standpoint of just time and access to care and support, there's just no other argument. It's so lopsided otherwise. And then when you take a look at the concept of employment, I just did a little video. We're trying to figure out how to purpose about the return on investment of the education that really should not required, but really the education that a health coach really needs to be successful and good at their job. You know, you can correct me if I'm wrong, but the average kind of well-regarded, well-equipped health coaching program that costs a tuition costs somewhere between $4,000 and $7,000. Okay, there's outliers, but that's kind of average, right? Whereas a 4-year degree plus an internship, depending on whether you're calculating housing and books, all this other stuff, somewhere between, I don't know, maybe around 80 grand, something like that.
I'd say more than that.
Maybe more, right? Up to $100,000. Meanwhile, the average salary of a full-time health coach versus the average salary of a dietitian entering the marketplace, they're both around $60,000. Okay, I paid, split the difference between maybe $6,000 for my education and training as a health coach, $100,000 as a dietitian, yet we're going to come out of our schools working full time at about the same. It's unbelievable to me in terms of the return on investment required for this. But to your point, we play different roles where some might be calculating a very specific diet for a very specific. Health coaches are in the, okay, you've been diagnosed. Here's what they're saying we should be focused on food. Tell me how you feel about that. Let's figure out how we're going to implement it. What resources do you need? Let's go, right? This is the role so two totally different roles. They are both equally valuable. You know, so for folks that are trying to make this decision about what you really want to be doing in terms of employment and income potential, I don't think there's enough of a difference on the other side to necessarily warrant the extra expenditure if what you really want to do is to help people actually change their lives long term.
And I always thought getting into health coaching is a really great way, because I know a number of programs also, the credential will count for credits if you do want to go back and pursue other education and nutrition, and other sciences. So, I always thought getting involved in health coaching, even if you want to kind of put your toe in the water of the health and wellness world, is a really great way of getting started, because you can either finish as a health coach or you can continue your education and move on.
100%. And there was an email that you sent out to the council that I really want you to speak to. And this is, I'm just going to kind of lay it out there because I know what you're going to say. The scope of practice of a health coach.
A scope of practice is a legal term, and it has a real specific meaning. And that meaning is when a state, legally recognizes a healthcare practitioner for the services they can provide. So doctors have a scope of practice, nurses have a scope of practice, optometrists have a scope of practice, chiropractors have a scope of practice. Health coaches, because we are both not healthcare providers and we don't have a legal scope of practice, what we have are practice guidelines. What we have are codes of ethics. which are great. Schools provide their graduates practice guidelines. They're sometimes referred to as a scope of practice, but legally they're not. They're practice guidelines. Associations and organizations like the NBHWC and ICF, they have codes of ethics. They have practice guidelines as well, and that's outstanding. So health coaches and holistic practitioners, we fill in the practice space, where licensed practitioners aren't involved.
Mhm.
And that is with that education, that support, that guidance, that advice in health, wellness, nutrition, stress management. That is a big, big space, and it's growing. And that's where health coaches and holistic practitioners practice in. And that's fantastic. And I want that space to kind of keep growing.
Mhm.
And I also want the Holistic Council to continue to protect it, because I think other organizations and associations see like, wow, look at all these health coaches doing really great work. I wish we could have a piece of that. And then, hey, how about we build a wall around this piece? And that's where we say no, that this marketplace, that these services are too important, too valuable, and they're still growing. And we don't want onerous and weird and vague rules written by one association for their own benefit. I don't know what health coaching is going to look like in 10 years. We don't know what the whole practice of holistic nutrition is going to look like in 10 years. But what I do know is that if rules and regulations get on paper now, they're really hard to get rid of.
Mhm.
And so we want it to grow. We want it to thrive. We want it to mature without needless rules, laws, walls, and barriers.
Right. So it's like the objective isn't to clob things back away from maybe the AND, but to create a different set, a whole new
Mhm.
set
Yeah,
of.
we don't like using their words. It's one of the things I really train our coaches and our organizations for. People say, "Oh, can I put together a meal plan for somebody?" I'm like, what do you work in a hospital? A meal plan? No, like meal. Who's ever done well with a meal plan?
Oh.
No, like work with your clients, develop strategies, like develop tactics, support them, guide them. Like who? I'm sorry, I'm getting. But
Perfect, yeah.
I mean, it's essentially decades of people handing somebody a piece of paper that said do this, and they don't do it, and then they get unhealthy. Like, why do you want to? Why do you want to emulate that? I would prefer people not do that. So for a long time, I've guided and worked with coaches on not using the words and not mimicking the services
Mhm.
of practitioners who have shown very little ability to improve the health and well-being of others. So we don't use those terms because they don't really make much sense and they don't work. So those are some of the strategies that we don't know what holistic nutrition is going to look like. We're not even sure of all the words it's going to use to communicate it. But what we do know is we want to make sure that there are as few regulations and barriers as possible. And that's what we work on at the Holistic Council.
I love that.
I wonder, so I feel like we three here have been kind of keeping our fingers on the pulse of this, just, you obviously in the advocacy space, the policy space, and us as educators. And I'm just wondering if maybe health coaches listening who are relatively new to the industry are maybe feeling this is all over their head a little bit. So can we talk about, so what you just, the bomb you just dropped is there's technically not a scope of practice for health coaches, but there are professional guidelines, there are codes of ethics. What would those be?
Well, you want to be upfront and truthful about your education, your experience with your clients. I think all health coach training programs provide, client services or client engagement letters. So review that. Be upfront and clear about the services you do and you do not provide. Your educational programs would have likely helped you along that path. And be sure to note the things that you are not. You are not a licensed healthcare provider. You're not going to treat, cure, or mitigate diseases, but you're going to, build strategies, resilience, and better health that might cure diseases,
Right.
but that's not your job.
Right.
And so I think, really working with the educational programs that health coaches and other holistic nutritionists have completed. They often have these resources. And then if you need assistance, reach out to the Holistic Council. We work with all of the students and graduates of our health coach training programs and our nutrition programs that are members. So if you have questions about this, we can assist.
So something I can say just from personal experience, when I first started my practice in my career, I lived in the state of Illinois, had some pretty tough laws in terms of the licensure laws. Again, what I try to explain to people that ask these questions is there is no licensure law for health coaches. There's no legal scope of practice. What there are is licensure laws that are on the books relative to other licensed professions that have exclusionary language that basically says, unless you hold this license, you can't do these things. So, and when I was in Illinois, there was a lot, the dietetic licensure law in Illinois was pretty restrictive, and that's getting better. I have since moved to Florida, where quite frankly, the law was worse at one point and is measurably better now that I'm down here. And that was all the work of the Holistic Council. And I have to give this organization of predominantly volunteers. I mean, I'm on the board, there's other board members, getting all this done on a shoestring budget. And if we had more to work with monetarily, there's so much more that we could do. And I just have to, I'm on the board, but I'm not paid for it. I'm strictly there because I'm passionate about this. That there's more of us, quite frankly, in the world, health coaches, than there are dietitians. And if all of us just put in $5, literally, it can do a world of difference in terms of protecting our ability to practice. And one of the things that comes up a lot in terms of providing health coaches with an avenue to employment or building a business and access to clients is the notion of being able to bill insurance. And this is something that has been sort of on the horizon that I know the national board has been advocating for. But I think a lot of the health coaches that are entering this space that have heard of this, I think what they have in mind is, hey, once this passes, if I become a certified health coach, I'm going to be able to bill insurance for my clients. And we have all been saying it's probably not going to work that way, at least not in the beginning. And I know that you have some thoughts around that. Do you mind sharing what you know at this point and your thoughts?
Sure. And I think what I know is not top secret, that American health insurance is complicated, right? I'm not telling anybody anything new here. I think what the national board is doing is outstanding, collecting the data on the efficacy and effectiveness of health and wellness coaching, and going through the AMA process of getting a category 1 code, which is a kind of understood and recognized service, which would be great. Some of the caveats there are, just because it receives a category 1 code doesn't mean health insurance companies have to reimburse for that. The other point is that health insurance companies reimburse for services, not people. Like, just because you're a health coach doesn't mean you get reimbursement. It's the health coaching service that would get a reimbursement. Additionally, as I'm sure we all know, dealt with insurance companies one way or another, that they put limits. And I just noted this earlier, Laura, when working with the registered dietitians. Insurance companies often put parameters and limits on the number of visits and the time, but also the cost. And so, there is a lot that we don't know about the process yet. And I am super glad that the NBHWC is going forward with this process, and there's data behind it, because I think it will lead to a lot of new opportunities and new pathways for people to practice and provide health coaching. But I think we just also have to be realistic and temper expectations that it's going to be complicated. It's going to be challenging. It's going to be difficult to navigate, even if there is a category 1 code. So that's just to say that we shouldn't all kind of just hang our hopes on that one decision, that it's really going to be up to the health coach on whether you become an effective coach or not. Like, I wouldn't wait for that one decision to really make or break your interest in your success as a coach or as a holistic practitioner.
Well, and my thought, and Aaron and I have talked about this before too, with other guests, in terms of the value, the internal sort of mental and psychological value to the end client when they actually have to pay for that service. Just how much more committed and invested they are. And Aaron lives in Canada. They don't really have private insurance. Everything's government funded. So she none of her clients that are from Canada anyway. Everyone just pays her, right? And same thing with me. But so those that are single payer systems or government funded healthcare, likely not going to be relevant there either. And we all just kind of need to move forward. Yeah.
But it's also going to state that, a lot of people even in the system, the really good doctors, the other, really great practitioners are trying to get out of the health insurance system. And so some of the best integrative care you'll find are cash. So I want to also, caveat that, when health coaches are working with a client, there are many different ways that a health coach can work with that client to find, ways of reimbursing or paying for that service. So what I used to advise people, at IIN and other places is that if you're working with a client, have that client check with their employer. Oftentimes their employers have employee wellness benefits. So check with your HR department. Is there a pot of money that that individual can access for a health and wellness coach? That has happened frequently. We've also told health coaches to work with their clients. And if their clients get a letter of medical need from their healthcare practitioner, it's just like something you print out online. They can often use what are called their HSA or FSA benefits. So this is pre-tax money for health and wellness coaching services. So, check with your clients, on that. And then even if you have a health insurance plan, check with that health insurance plan. They might have benefits and other services available to you as a client, to use. So those are three pathways of significantly reducing the cost of health coaching services. It might take a little, work on everyone's end, but you could. I've known many health coaches that found that their clients have utilized those pots of money and other services for health coaching services.
That's really cool. That's incredible advice. I definitely get a lot of clients who will pay with their government sponsored wellness plan. And it's pretty broad. It's kind of anything. You can buy a bike, you can get a gym membership, you can work with a health coach. It's sort of whatever, but you have to ask for it. And I will say that, this idea of like really wanting to be able to use insurance codes so you can kind of play in the big leagues and have all these people who aren't paying, to Laura's point, when people don't pay, they don't pay attention. That's some business kind of, business, whatever, health coaching business advice we give. But that aside, it's also our opportunities as health coaches within the collaborative integrative medical system. It's growing. Like we're going to have opportunities to be in this world and staying in our lane. And irrespective of what happens with these insurance codes, those opportunities are there. And I think to your point, Darrell, it's like, become a good coach, be really masterful at coaching. Don't wait for insurance codes to become a thing before you step into the space. I've been practicing for 12 years. I've had 2,000 clients who've all paid me out of pocket. They're out there. And in the meantime, you're developing your health coaching chops, and you're really learning what you can help people with, and the clarity when you realize, wow, I can help hundreds and hundreds of people with things that a doctor hasn't been able to, or a dietitian hasn't been able to. It's really empowering. Like our opportunities have always been very rich, and it's growing. So
yes, they have. And then the integration of health coaches into the kind of traditional medical space is significant. I was on a webinar recently, and there is a pain management physician who, uses health coaches just to work with people, on talking through their physical pain, and found that people that just work with a health coach and they just talk about it, maybe do some basic exercises and stretching, have significantly reduced the amount of opioids they use. And so there are a number of different ways that health coaches will be utilized, in more traditional healthcare settings. I'm just want to put a note on that, let's not just wait for, a CPT code before exploring all those options. So if you know of integrated healthcare practitioners or even traditional ones that are interested in, really addressing behavior change with their patients and their clients, recommend health coaches reach out to them.
Correct.
If you take a look at the, because I've been doing this for our school, and I know Erin's looked at it too. Like you just put in a job filter on either Indeed.com or LinkedIn or any of those things. There's literally, I'm pinged every single day with more opportunities. And if I were to break it down by industry, the vast majority has some, it's either insurance companies like United Healthcare, Humana, they're one of the leading employers of health coaches. CVS hires health coaches. A lot of clinical practices, hospitals, government, like NGOs, like non-government organizations, but they're kind of funded by the government that provide benefits. They all hire health coaches. So the number one area of employment opportunity is in these areas. And this is where I think maybe reimbursement may become helpful, is perhaps in increasing the pay and kind of what companies can afford to pay health coaches moving forward. But, when I did an initial search about 5 years ago, the average salary was like 35.
And there weren't that many job ads
at all. And now it's closer, 50, but I'm seeing like 65, and honestly, the ones that are paying a little more do want you to be national board certified. They want you to have 5 years or more under your belt. So to Erin's point, just get out there and get experience and become a really good health coach and speak the language and apply for these jobs. And just, you can share stories of the clients that you've helped and the outcomes that you've seen. There's lots of smoking cessation programs. There's many now in terms of,
Well, I was going to say there's tons of like private companies that I'm seeing on these job searches. Like we're a company that helps middle-aged men with obesity, and we have a doctor and a dietitian, and we have virtual health coaches. Or we're a company, the pain management company, as an example. There's all these privately owned companies now that are, I guess, feasibly run or overseen by doctors that are bringing in virtual health coaches for this.
Yes, this happens quite a bit. When my last position, I was speaking to many of them. So what they'll do is these private companies go to a large employer and say, hey, we can reduce, because a lot of times large employers are self-insured. So they kind of pay and they, it's in their best interest to make their employees as healthy as possible. So they hire these third-party companies, and it's that physician, maybe physical therapist and health coach, or physician, dietitian, health coaches. And they've shown to be like incredibly successful with improving health and wellness, self-reported health, but also lowering, a lot of the bad markers and improving a lot of the good ones. Those do exist. There's a number of companies like Hinge and Berta,
Hinge is another
Vera. There are a number out there. They're really outstanding.
So there's never been a better time, honestly, I think, to be a health coach in terms of, I think like when Erin and I first started, in the terms of trajectory, we were way down here, and now it's on this huge, you're still way up on the upswing, and people have at least heard of health coaching. They might not necessarily really understand what it is, but most of the people that when I say that I'm a health coach, they've at least heard of it for the most part, which I don't know.
It is helpful though, isn't it?
Yeah, it really
does. You don't
does.
have to start from square one.
Yeah. And, one thing I want to touch on before we let you go in terms of, hey, we're seeing positive changes in markers, is this concept of sort of lab testing in our space. Because to your point, the direct-to-consumer resources available today is unbelievable compared to where we were 10 years ago. And it is now, unless you live in specific states, like New York is one that I know doesn't allow consumers to order labs directly, but the majority of states do. So now we have access to data trackers, access to lab work, and health coaches want to be able to help their clients with this kind of stuff. And these are murky waters. But I know you've been doing some work and some research around this and talking to people. So do you mind kind of sharing your thoughts?
Sure. The world of lab testing has exploded and grown so much over just the past few years. I think culturally, we're all much more comfortable with it because of COVID, where you had to self-test with lab tests just to kind of go to school or get on a plane or go to work. So, we're all, as a society, both, in Canada and US, we're just more comfortable with lab testing culturally. And then there's now more technology that make these tests more available, that test for a range of issues, imbalances. I mean, this is everything from toxicity, like metal toxicities, to gut microbiome makeup, to vitamin testing, to micronutrient testing, to gut health testing. I mean, there are dozens of companies that all offer hundreds of different tests. So my understanding is that there are between about 2,500 and 3,500 different tests that individuals can purchase and be delivered to their door. Many of them are kind of saliva swabs. Some are hair. Some are finger prick tests with a little blood. Some are urine. Some are stool. They pretty much run the gamut. And so all of these tests are now available to individuals, whereas just maybe 5 or 6, 7 years ago, they weren't. The reason why that they're available is that what these labs are is they're called lab developed tests, that they're developed to test specific things, hormone levels, vitamin levels. And because they're not testing for diseases, individuals can order them. And so the question is, well, what role can health coaches play, or holistic nutritionists, just kind of making the pie large? What kind of role can they play with these tests? And I have not found any regulations that say health coaches or non-licensed practitioners or wellness practitioners cannot. So there's that off the bat. Secondly, these tests don't treat for diseases. They treat for optimal health and wellness. So that is right in the kind of field of health and wellness coaches. Third, these companies that provide access to these tests are very savvy, and they know, which ones are best for certain practitioners. And so there are multiple levels of safety kind of built in. These tests don't treat, for diseases. So, that's why individuals and health coaches can be involved in them. Taking a swab or sending a hair follicle back is not very dangerous. 3, these companies also have kind of internal policies to make sure that the people and practitioners they work with are following their rules and regulations and guidances and disclaimers as well. So that's super safe. And so I encourage health coaches and other, wellness practitioners to seek out these really innovative tests and figure out what they are comfortable with, what their education and experience and knowledge is of these areas, and find out if you want to incorporate it into your practices for your clients, because they can be very, very insightful. And why wouldn't we want to use these tools?
Well, that's interesting. It's interesting. So yeah, I mean, you explained it well. It's like they're not testing for diseases or there's nothing diagnostic really there. It's just sort of shoring up insufficiencies or giving you information to make moves. So that's promising, actually. It just feels like it feels like. I wonder if there's some training, though, that a health coach needs to know how to remain perfectly within their professional guidelines. You know what I mean? Like,
well, what's interesting is that I've taken a look at some of the tests themselves, and the results that one gets are usually not just raw data. There's like descriptions and guidances by the testing companies.
True.
And then also all these testing companies, before a test is purchased, a physician in your state reviews it. And if there is anything that comes back to the client or to the coach where something is so out of whack, that the physician is notified, so that there are multiple levels of safety kind of built into the process. And so, yes, health coaches, before they engage in some of these tests with some of these companies, they might, require coaches have certain qualifications or backgrounds. And also the testing companies provide like licensed healthcare professionals on duty for any coaches or others that have questions about them. But because the tests are not assessing diseases or needs, but really working on optimal health, that's why they're essentially available to the general public, and health coaches and other holistic practitioners can be a part of it.
Well, I didn't know that part about the fact that every test is ultimately run past a physician or a team of physicians to see if there's any red flags, anything that needs to be escalated.
Yeah, so that's how the business has been developed over the years. That so when a client purchases a test, they're not ordering it; they're purchasing it,
Right.
and then that purchase goes to a physician who then orders the test.
Yeah.
And the test is then sent either to the coach or usually to the client, and the client takes the test and then gets the results. And if the results for that particular test, like let's say you're just testing for overall, a vitamin panel, and let's say something's absurdly low or incredibly high, you will get a notification from some licensed healthcare provider that something is incredibly out of whack. So what's great about this, and I think everybody's kind of mindful, is that they built in all these kind of safety mechanisms to it. And so people get that really good, that information, that advice, that guidance about their well-being. And if any red flags come up, that they can do it.
Yeah.
Cool.
Yeah, there's more and more of them popping up now. And many of them have reached out to us looking to partner, and we have been open. As a matter of fact, Aaron alluded to, gee, I wonder if there's a space for training in this. A lot of these companies do offer it, actually. They have information and little training videos and samples on their websites so that both the consumer and the health coach can kind of understand what it is these things really mean in terms of practical advice. But we to your point, let's not use their language. Health coaches don't order labs. We don't taker labs. We don't translate labs, and we don't diagnose or prescribe anything as a result of these labs. We don't do any of these things. The client is free to order a direct to consumer lab, not order, purchase. Okay. Let's not use that language, and let the doctor on the other end say, okay, I'll order the lab. And then those labs then know that the end person receiving this result is actually a health consumer. It's not another practitioner. And that typically speaking, those results are going to come with some sort of context, that the client and the health coach can work with. And so, we've been here at Primal Health Coach Institute, been looking at trying to kind of aggregate all of these resources together so that health coaches and their clients know what's out there and how to use them properly. We're growing. I'm a little choked up about when I first went down this path, over 10 years ago, I had no idea what the heck I was doing. I just knew that there were a lot of people that were where I was a couple years prior that I could help. And I just wanted to move in that direction and do anything I could to help. So I went and paid $6,000 for my first certification. No idea what I was going to do with it. I sort of stumbled my way to where I am now 10 years later. I know Aaron entered this field around a similar time, and I talk to people all the time as well. And seeing where health coaching is now is so inspiring and empowering to me. And oh my gosh, we're just getting started.
Cool.
We are. It's exciting times, and that's why I want to make sure that the council is well supported. So we recommend any of your listeners, visit the site, make a contribution. If there are any real innovative thinkers and doers out there that want to figure out ways of partnering with the Holistic Council, please reach out to us. Just visit the website, holisticcouncil.org. And super want to thank Laura and Aaron, and also Primal Health Coach, for being a longtime supporter of the Holistic Council.
Well, we believe in it, and we're just getting stronger by the day. So fantastic. So holisticcouncil.org. Are we on social at all? Is there an IG or a Twitter or anything that people can follow?
We have a Facebook page. Yeah. So I've got to talk to my social media team, which is also me, and tell them to I'm the finance team, I'm the website team, I'm the social media team. We have a Facebook page, but a lot of our communications are state specific, and they're to our members, to take action on state specific issues. It's challenging because as a policy organization, you don't want to post too much because we have quite a bit of advantage when we don't really advertise exactly where we are and what we're doing, because it's a kind of a legislative piece to it. Though I do think we should probably spend a little more time on our socials, but I get so into the policy, not sure how well it always translates to
Sign up for
an
the
IG
emails,
post.
subscribe to the emails, become a member, whatever. Do some sort of like monthly, I don't know, even $5 a month makes a massive difference when you get enough people in it. Get on the email list because I get all those email blasts of everything that's happening, and it fires me up every time I see them. So,
Yeah, and if anybody that's listening in their school or their program is not a member of the council, please reach out to your program ASAP and get them to become a member. And the list of members is right on the website.
awesome. I think we covered it. Fantastic. Thank you so much, Darrell. This has been awesome.
Thanks, everybody. Really appreciate it.
This podcast was brought to you by Primal Health Coach Institute. To learn more about how to become a successful health coach, get in touch with us by visiting primalhealthcoach.com/call. Or if you're already a successful health coach, practitioner, influencer, or thought leader with a thriving business and an interesting story, we'd love to hear from you. Connect with us at hello@primalhealthcoach.com and let us know why we need to interview you for Health Coach Radio. Thanks for listening.